and urinary bladder.
Oh, okay.
This is the rectum.
Oh, that's it. Okay.
Okay, so this is like here. This is just the cross section of it. Let me start with the uterus. So this is the uterus. So is this. This is the uterus. It lays on top of the urinary bladder. So when women are pregnant, it pushes on the urinary bladder, so it's peel
smaller
out.
bladder. Okay, that makes sense.
Wait, so uterus, urinary bladder?
Urinary bladder.
On top.
Okay.
Cool.
Rectum,
Where's the
uterus.
urinary bladder on here? Just that?
So yeah, this is the top of it. That's the bottom.
Bottom. Okay, okay.
So you have these ureters coming in.
Okay.
That's what
Those are.
Yeah, and on here, I can't see them.
Is that white thing?
That right there is the ureter.
God.
Yeah.
How'd I
That
miss?
so that goes up and connects to the kidney. Yeah. On the uterus, you have these tubes, which are known as the oviducts, or the fallopian tubes, or the uterine tubes. They're all the same, so use whichever one you want. I like oviduct; it's short and sweet.
Yeah, that's right.
So this region where it first comes out of the uterus, that's called the isthmus of the oviduct.
Okay.
These are the fimbriae, those little finger-like projections that hang over the ovary, and this is the ampulla.
Okay.
Ampulla, fimbriae.
So ischium, ampullae, I can't remember.
Fimbriae. Yeah.
Cool.
This is the ovary. This is the ovarian ligament, which just kind of holds it in place. Some other ligaments, you have the round ligament of the uterus, which comes out the front. It's the round ligament. And you also have the broad ligament, which is just all this tissue. It's not very discrete on here, but it's just, I guess you could say this is all, not that, but this is all broad ligament.
Okay.
Yeah. And then you have urinary bladder, half this. This area back here in the back of the urinary bladder, it's called the trigone, because it makes a little triangle. It's just makes a little triangle where the ureters come in, ureter, then start of the urethra. So yeah, so that tube's the urethra coming down. So it's the uterus in cross section. This interior lining, that's the endometrium. So that's the lining that gets shed during menstruation, is that endometrium. This thick layer in the middle, that's the myometrium, just meaning muscular. And this is the perimetrium. Perimetrium, myometrium, endometrium. The opening, or the beginning portion of the uterus is called the cervix. So that right there is the cervix. This model, you kind of see it better, so yes, the cervix as a whole right there.
Okay.
And that opening, that's called the cervical os, OS, cervical os. It's just this opening right here, and then cervical canal. So this is the vagina. It's not, when you think vagina, you think of this, the opening part, the beginning part,
Right.
but it's actually the tube. All this external female genitalia, that's the vulva. Okay, so that includes the labia majora, labia minora, the clitoris, the hymen, which is just this little flap at the beginning of the vagina. Yeah, just everything external is broadly referred to as the vulva. Yeah, okay, vagina.
And this is the same thing, essentially.
Yeah, this is the uterus.
Just born up.
Yeah, ovary, fallopian tube, fimbriae, ampulla, isthmus. This is the broad ligament.
Okay.
That shows it a little better. Let's play name the tube. Okay. What is this?
Cervix?
Is it the anus?
Yeah, that's the anus.
Oh, it's
So
the,
that's-
it's flipped around. Okay,
yeah.
okay.
This is the
That's the that's a urinary bladder, right?
yeah. That's the vagina coming into
that's that, okay.
the cervix and uterus, and this is the urethra.
That's what I thought
Yeah,
it was.
urethra, vagina, anus.
Okay.
Okay.
Labiator, anti-muscle, all those.
Yeah, we'll go over those
Okay.
in a bit. Okay, pubic symphysis.
Yeah.
Like I said, labia majora, minora, hymen, vaginal canal. This is the clitoris. This is the glans clitoris. Is a glans penis? It's just the head
end
of the
of it?
penis.
Okay.
So same thing with the clitoris. It's just the female analog, pretty much. the body of the clitoris. You have this, which is known as the vestibular gland, and this is actually a part of the clitoris too. It's the bulb of the clitoris. So the penis has the bulb or the root. That's pretty much the analogous structure. Yeah, that's the vestibular gland. Yeah, this is labia majora, labia minora. We're done with that. Okay. Name the tube again. What's this? What tube is it?
So this is the anus, all right?
Anus, yeah.
So anus, vagina, no, your vagina, right?
No.
No.
Oh, to the
Right.
decument, okay.
Yeah. So, urethra. This is the urethral orifice.
Okay.
This is the vaginal orifice. That little flap right there, that's the hymen.
Hymen, okay.
Yeah, labia minora, majora. That's the clitoris. Yeah, anus, rectum. Yeah, let's go over the muscles now. Grab male too.
Please, space.
Okay. So here's male versus female. These muscles back here that go kind of posteriorly from the anus, those are the levator ani muscles. Levator ani, ani. Those guys. And that's what these are.
Okay.
Okay.
So
Then
they're
you-
bigger because of childbirth, right?
Right.
Is that okay?
Yeah. This is the anus, so these are the external anal sphincter muscles. External anal sphincter muscles. Okay. These guys going transversely, those are the superficial transverse perineal muscle. Yeah.
Okay.
Superficial transverse perineal. The perineum is just this region between the vagina and the
Where you
anus.
rip
And,
during childbirth.
yeah.
No, that's right, I remember that
Yeah,
one.
so it's the perineal region, so external transverse perineum. These guys, that's the bulbospongiosis muscle.
Okay.
Kind of looks bulb-like.
Yeah.
Bulbospongiosis.
So this is bulbous, and these are the
Superior transverse.
Superior transverse perineal muscles. Yeah.
Okay.
But on the female, those bulbospongiosis go on either side of the vaginal opening.
Okay.
Bulbospongiosis, bulbospongiosis. Here they're just together. And then you have these guys. These are the ischiocavernosus muscles, coming from the ischium. So that's what these are, ischiocavernosus muscles.
Okay. That's not bad.
And on the males, a couple more. You have the cremaster muscle, which are these ones that kind of raise and lower the testes. Those are the cremaster muscles. It's based on temperature.
Wait, so when you get a hernia, do you hurt those?
When you get a hernia, there's a. I'm just trying to show you.
Because they don't come up, right? That's the problem.
Well, a hernia just means you have some of your intestines that actually punch through.
Why is it when you cough that they don't? You know what I mean? When they give you a physical and you don't cough, is that why?
It means that there's some intestines that might be in
Oh,
there.
in the way.
Yeah.
Oh, okay. Jeez. Okay.
Yeah. It's
Worse than I thought.
pretty severe. Yeah, there's this membrane right here. It's called the pelvic diaphragm, I believe. And so when you get a hernia, sometimes the intestines kind of break through that, or they break through this
Oh.
inguinal ligament.
Jesus.
Yeah.
Man. Alright.
Because you're putting so much strain.
I just can't
there.
hold it. Yeah.
Yeah. Yeah, because during development, your testes start out actually up in your abdomen,
Right,
and
right.
they just slowly
Drop.
descend, and they go through that membrane, and so it's kind of a weak membrane. It doesn't fully heal, I guess.
The dartos muscle.
Yeah, dartos muscle is just these cross muscles right there.
Okay. Will you go over the male?
Yeah,
too?
look at that. This guy's missing a penis.
This looks like a face.
Ew.
Look, his eyes, his mouth.
Stop.
Yeah, I can see that. Alright. There. Let's put this back.
Drunk.
Alright. Now for the male. So a male has no uterus. It's just the urinary bladder,
Makes sense.
and anus, or sorry, rectum and then anus. But we have a prostate gland that females don't have, and that just contributes fluids into semen, just kind of nourish the sperm a little bit. Yeah, so we have the trigone as well. That trigone area inside the urinary bladder, that's the ureter.
Okay.
So urethra. So in males, the urethra is broken up into three parts. You have the prostatic urethra, which goes to the prostate. You have the membranous urethra, which goes through that muscular membrane. Then you have the spongy urethra, which goes to the penis. And that's the urethral orifice, just the opening.
Okay.
This is the ejaculatory duct. That's where the seminal vesicle and the vas deferens connect. So I'll show you that later. So you have the root or the bulb of the penis back here. This is the shaft of the penis, and then you have the glans penis, which is the head. You have the prepuce or foreskin, which covers the penis. On the inside, this is known as the corpora cavernosa. Corpora cavernosa. So that's just the kind of porous, spongy-like structure that fills with blood and that causes the erection. That's when this fills with blood. You have the corpus spongiosum, which surrounds the urethra. It's the corpus spongiosum. And like on the board, you have those kind of two structures. So you have two corpora cavernosa and one corpus spongiosum just surrounding the urethra. Okay, so there's the prepuce, this is the glans penis, and this is the corona of the penis. It's the rim. Okay, so
Like, I'll do more.
So, like you saw in the mink, this is the scrotum. And you have this lining over the testes, that white layer. That's the tunica vaginalis. Then you have the cremaster muscle, dartos muscles, and this as a whole is the spermatic cord.
Oh, that's okay.
Yeah, spermatic cord. And this is the inguinal ligament. So this portion of the spermatic cord kind of goes through that inguinal ligament. It's called the inguinal canal. So that's just this region. It's inguinal canal. The spermatic cord is filled with blood vessels and the vas deferens. So this is the vas deferens, comes up from the testes, comes up from the epididymis, which you don't have a good testes anywhere. And then goes around the back of the urinary bladder. This is the ampulla of the vas deferens, which then empties into the ejaculatory duct, which is there. And this is the seminal vesicle, which empties into that same duct. Yeah. So that's the ejaculatory duct, that same one right there, that enters into that prostatic urethra. This is the bulbourethral gland, or Cowper's gland. What else? Pubic symphysis. I think that's about everything. Cool.
Nerve, artery, and pemphiform.
That's just the.
I don't know.
Those are the blood vessels inside this spermatic cord.
Yeah.
Okay, just making sure.
Yeah.